Dementia is not an illness. It's the name that we give to a set of signs and symptoms. They're all clustered together. And when signs and symptoms cluster together, it's called a syndrome. And you've got to give the syndrome a name, and the name is dementia. Those signs and symptoms are about losing your memory, your ability to think, reason, exercise judgment. You can't communicate as you once did, so you don't understand what's being said to you. You can't say what you wish as you once did. That's what dementia is. Identifying early dementia isn't easy, and it's not easy because it's forgetfulness. Nobody has a perfect memory. So at what point does your imperfect memory give you the evidence that there's something amiss? So what you're looking for is somebody who in their normal everyday situations that they know well seemingly becomes inexplicably absent-minded. So it's a combination of forgetting little things and doing silly things. And what I always say is, if someone's acting out of character, so if they seem to be a little bit more withdrawn, if they seem to be worrying and fretting themselves about forgetting, then take that as a sign. And what is very important is that most people who are living with dementia are over the age of 80. What causes those symptoms? They are irreversible, progressive brain diseases, the most common of which is Alzheimer's disease. Brain cells dying as a result of Alzheimer's disease in their millions. And as your brain cells die, your brain shrinks, and as a result, you get all those intellectual signs that I described. The second most common cause is known as vascular dementia. Brain cells die as a result, but they die because the cells are starved of their blood supply. As the brain cells don't get their blood supply, those brain cells die over time. There's probably over 100 different diseases that cause dementia.